Good morning, ladies and gentlemen. My name is Edith Lengwe, a nurse counselor and an HIV activist from Zambia. I'm an ambassador of INERELA, and I'm delighted to stand here to share one important topic in my country about HIV. INERELA stands for International Network of Religious Leaders Living with or Personally Affected by HIV and AIDS. I'm honored to speak to you on HIV response in Zambia, particularly in Kabwata community where I work from. Zambia is a landlocked country situated in the sub-Saharan region of Africa with a population of about 15 million inhabitants. It is one of the fast developing countries in the region. The country is surrounded by 8 neighboring countries, namely Angola, Congo DR, Tanzania, Malawi, Botswana, Zimbabwe, Mozambique, and Namibia through the Cape Strip. The major economic activities of Zambia include mining, agriculture, and tourism. Against this background, there is a high mobility and interactions activities going on in the borders of the country. As such, HIV prevalence is still high in the country. At present, the HIV prevalence rate is at 11.3%. This is according to the Zambia Population HIV Impact Assessment report called Zambia of 2016. HIV is still among the top 10 diseases burden in the country. The government hasn't stayed idle. It's so committed to reducing this high prevalence of HIV. As such, it has put health as a top 10 priority and a top priority disease to tackle. To do this, the government has demonstrated by building several clinics around the country. This is with a quest to bring health as closer to the people as possible. The government has also continued to train staff and employ staff. To add on what the government commitment, it has also managed to purchase advanced medical equipment. With this, a very enabling country or a very enabling environment, health facilities in collaboration with partners such as CIDAS, CDC, and ICAP, just to mention but a few, have linked together to come up with strategies to reduce further prevalence of HIV in the country. Now I'm going to share with you some of the strategies which have been put in place to reduce the scourge. The effective role of rolling out the UN AIDS target of 90 by 90 by 90, the Zambian government has deliberately increased the target to 95 by 95 by 95. This is by 2021 target. By this I mean the Zambian government has set itself a target to increase from 90 to 95. The first 95 population is from the total population of the 15 million of Zambia to know their HIV status. And then the next 95% is those who know the HIV status should access treatment of HIV. And the last 95% is those people who access treatment, they should have their viral loads suppressed. The tools to guide the implementation of such a robust target are also put in place. The tools, which include the national health policy, is in place. The national HIV policy of Zambia of 2017 to 2021 is readily available and readily accessible. There are also guidelines which have been put in place in order for health personnel to follow in their quest of achieving 95% by 2021. Logistics needed to carry out the activities are readily available. The other things which is in place is the introduction of test and treat. By this I mean, if I'm tested today for HIV and I'm found to be HIV positive, the same day today I need to be commenced on ARVs. Test and treat include the provision of adequate counseling and testing, and also the effectiveness of a courier system. The supermarket approach of providing services has helped to provide a comprehensive service of this at the same time. By supermarket approach, I mean whenever you are carrying out HIV activities, you need to include other health services. Health services like family planning, they need to be ready accessed. Antenatal care need to be there. And lately, we have also included cervical screening. You know, you and I, that cervical cancer is also quite rampant in the Africa region, especially in Zambia, where I'm coming from. Training of youths to compensate or to comprehend, or rather to help in the HIV activities has proved to be very successful. Youths are trained to target their fellow youths in terms of counseling them and testing for HIV. Once the youth has counseled the fellow youth and has tested for HIV and found to be positive, the client is physically escorted to the treatment center where the positive youth is initiated on treatment. Free distribution of condoms is also one strategy which has really helped to give hope to the people and to try and reduce the high prevalence of HIV. Condoms are freely distributed in Zambia in all strategic places. And they are also given or distributed in places like the colleges, universities. And lately, we have also put a deliberate policy to distribute condoms in strategic places at health centers. All departments can distribute condoms. Viral load campaigns, it's one strategy which has really helped to target our population in terms of finding out whether they are adhering to treatment and whether their viral load is being suppressed. So we often carry out campaigns deliberately to check for viral load. Coupled with campaigns, we also do the HIV indexing. This is where we do, when a person has been found to be HIV positive, it's mandated upon the health workers to visit that family and test the other family members in that household. This has also proved to be very good. It helps in terms of destigmatizing somebody and also reducing the stigma which is associated with HIV. Tracking clients has helped to decongest the facility in that we have put deliberate measures of using community pharmacies. Clients who are found to be positive, they are free to access ARVs in some of the communities within Zambia catchment population. The integrating of smart care is one component also which has really helped to decongest and improve the efficiency of carrying out HIV activities in Zambia. Intensification of health education and creating good rapport with the community is paramount in HIV work in Zambia. With these few remarks, my colleagues, I want to thank you so much for listening to me, and this is the end of my report to you. Thank you.